Hi, my name is Teresa Thamberi. I'm a Year 5 veterinary student in Fiji National University. In this video, I'll be talking more about my assignment topic, that is avian influenza, in the unit of VHS 701, that is study second. To begin with, avian influenza is caused by orthomyxovirus. There are several serotypes. Currently, we know there is 16 H type and 9 N type, and they can show up in all combination. For poultry, the most important one are H5, H7, and H9. Pathogenicity varies with the strain, that is high pathogenic avian influenza and low pathogenic avian influenza. For transmission, avian influenza is secreted from nares, mouth, conjunctiva, and cloacas. Airborne virus particles from the respiratory tract dropping, and people carrying virus on their clothing and equipments are the main route of transmission. Migratory waterfowl and other wild bird infected with avian influenza virus may be the source of infection. Species affected. Avian influenza virus have been shown to naturally infected a wide varieties of wild and domestic birds. In poultry productions, main problems are in chicken, turkeys, and duck. For clinical signs, bird can show hardening, subcutaneous swelling can be seen on the head and the neck area, nasal and oral discharge, ruffle feathered, swollen cyanotic comb and wattle, and also conjunctivitis with the respiratory signs. For gross lesions in hypopathogenic avian influenza, open swollen wattle, lung hemorrhage around the heart, hemorrhage on the trachea, and for diagnosis, clinical signs are the indicative for avian influenza. Final confirmations by laboratory testing, that is a direct detections of avian influenza protein from the nucleic acid RNA using PCR. The virus isolation from infected organ, that is tracheal and cloacal swab. Serology from blood sample after infections, and for routine monitoring showing specific avian influenza antibodies. Treatment: there is no treatment for avian influenza. Antibodies will help to control secondary bacterial infection. Last one is prevention and control. In many countries, avian influenza is a notifiable disease with specific local regulation on its control. In avian influenza-free area, the disease is controlled by monitoring and stamping out. In case of low pathogenic avian influenza infection, areas, countries can decide to allow vaccination only for low pathogenic influenza. In case of endemic, high and low pathogenic influenza, vaccinations might be allowed. Vaccination is generally done with inactivated avian influenza vaccine based on the strain H type causing the outbreak. That's all for my video. Thank you very much for listening, and God bless.